Hey, it's us. How you
It's
doing, man?
us. What's up, man?
Good to see
Dude,
you, brother. It's
hey, you
always
know
a
what?
pleasure, man.
I look like you now. I'm all professional here. I got a
Oh,
whole soundboard and everything here, man. This is, hey, we're all bougie and stuff now.
and by the way, you're sounding good on YouTube. From what I heard, you sound good.
Oh, nice.
We having a little bit
Appreciate
of
it.
issues earlier. No worries, no worries, no worries. So, um, it's gonna be a great night, y'all. I just want to let y'all
Yes.
know it's gonna be a fantastic evening. Um, hopefully, we'll keep around that hour, if not maybe hour 15 or so. But um, we got a super awesome guest for y'all. With I mean, when I'm saying a plethora of information, that's an understatement.
Yeah.
I mean, and this is a professional. I mean, um, it's going to be a great one. I don't want to let too much out of the bag.
It's hard not to let it out, isn't it? It's like we're
I'm
like,
so
oh,
excited. I really am excited though.
yeah.
But I will say this, as you know, every time we start a new episode, first thing we want to say to all our viewers, if you are thinking about hurting yourself, please reconsider. Pick up that phone, dial 988 Gearheads and Guardians at gmail.com. Give us a shout. We check them email as often as we can. And we do have a Facebook page. You can try to get us on Facebook sometimes too. But if you're ever considering something like that, just remember one thing, and it's a huge thing. We can't win the fight without you.
That's right.
We can't win without you. And I don't like to lose at anything. So I'm
No.
going to do anything and everything I can to help you get to where you need to be.
988, please. Please.
Absolutely.
We did this just this past weekend. We had a call out through people through Facebook, said we got a veteran that needs help. I know the family. I know this young troop veteran, and good to just to let you know he is responding very well. So
Fantastic. Fantastic.
he they have a bottle of Vibe, and already it's wow. I don't have this shaking up here. Now it's starting to calm down to a mild roar.
Right
So
on. Right
we're moving
on.
forward. So anyway,
Way cool. I'm glad it's working out well for
yeah,
him. 'Cause I mean, we're vets, man, and as NCOs, that's a big thing that we
yeah,
always uh, put everybody else in front of ourselves. They come first,
yes,
and that even though that we're not in the army anymore or not in the service anymore, that's still important to us. I mean, so
yeah,
if
and it's
there's
not.
if there's anything we can do, just let us know, and we'll try to help you out as best we can.
It's like the American Legion, and it's like what we're doing with the riders and with all the veterans at the American Legion, and it's
Right on.
this is why we have the podcast. Next week it will be 1 year of doing this, and we've grown and reached are getting more, let's say, more people to actually be involved with what we do. So it's
Absolutely.
really awesome. And tonight is one of those nights. I say it every time that we have Zalise board members on, or we have court, people
Right. Corporate.
from
Right.
we, and it's always another step forward of, man, look, more information, more learning, more of what
Absolutely.
we're doing. But tonight is kind of special for me because this is, I don't know, 15 to now. That's what, 29,
9 years.
9 years, right? Has now come into tonight. I have always talked about you like feeding off of what I've been through with my health so we can get your health right. You and I talk about all the time,
Sure.
right? And this
Absolutely.
is what we're going to do tonight is what I want everybody that's watching and everybody that's going to be watching later on. This is why we do this. I'm bringing out in the open my entire medical history of this with results, with blood results. I mean, y'all going to hear it all. So this is why we do this, and I'm really excited. Of course, it was brought to me that I actually kind of withheld some information from, from this person, and she just
Yeah.
reminded me, and I'm like, oh,
Oh crap.
Damn. So, man, I'm excited.
Busted.
So, you ready? You ready?
I think we're ready.
Are we ready to lay this on the people?
Ladies and gentlemen, boys and girls of all ages, and all you freaky people out there, we have the most awesome person for you tonight, Dr. Jill McPherson. Welcome to the show, ma'am.
Thank you for having me, and I'm so excited to be here. I really love how you guys started off your podcast with taking care of our veterans, and if they have thoughts of harming themselves, that you want to help them. So, because that is such a need and very near and dear to my heart. So, thank you for starting your podcast and everyone that way. So,
thank you. Well, we got to have a thing, where we think 22 is 22 too many.
Yes.
So,
yeah.
I totally agree. So
and doing what you do, Doc, it's we deal with it as we live with it, and we deal with it as we talk to our brothers and sisters. But you are actually you have people's lives in your control in the sense on how more on the when we'll talk about it here in a minute, but more on the whole health side. But back when you were the practitioner, back when you were actually oncologist, I mean, oncology is that's not a job you took very, very lightly. It was very, very in depth, our conversations about health. So, but we'll get into that here. Welcome again, ladies and gentlemen, Dr. Jill McPherson. A little background. You've all heard my story, but we're actually going to take a knife and we're going to open it up tonight, because this is the person that has been through every step of the way with my health. Every decision that I've made, every question that I've ever had, every phone call, text message, hey doc, what about this or what about that? This is the person that has guided me through this, to where I'm at now. So, 2013, I was diagnosed with CML, chronic myeloid leukemia. And I want to point out something too, Doc, and you weren't here. Dr. Hiley was the one that initiated this, because I saw him first, but he actually told me that there was another veteran that was diagnosed the same day I was, and his turned acute within a couple of days, and they sent him to MD Anderson, and he didn't make it. So I want to preface that on how remarkable your care and what you've done for me and other veterans. I know tonight's about us, but all of those veterans that you took care of in the chemo, the ward, right, and everything. That's what kind of makes this very interesting about what you and I have gone through. So, then in 2015, Dr. Hiley got busy and said, all right, Dr. Jill's yours. You started in on me. And, I have to thank you for everything that you've done for me. Let me go ahead and start that off first, right? It was a rough road in the beginning, right? Being told that you've got 90,000 white blood cells in your bloodstream and not having any idea. And then I'm going to go racing. I went racing that Saturday. I found out that Friday. I went racing that Saturday and still had no idea what exactly it meant. And then it really kind of set in after you came aboard and were talking to me about my body rejecting the first chemo, what have you not. So let's dig into that beginning real quick. Your time in oncology, what was that for? What was that, before I came along, in the sense, what was that like for you? Like, how was the oncology world?
So, if I can just clarify a little bit here. So I am a nurse practitioner. I do have a doctorate of nursing practice. So I am a nurse practitioner. I'm board certified in family practice. I also have an advanced oncology certified nurse practitioner certification. I've also gone on to get an institute from functional medicine. I'm a certified practitioner through there. So I just wanted to preface that I'm a nurse practitioner. Also wanted to just say this is not I know I do work for the VA. This is not VA driven in any way, shape, or form. This is Drew's and my journey, how we came to be, and how we decided in a team based approach, and what was important to Drew. I'm sorry, should I be calling you Nitro? I'm having a really hard time with that. I'm just saying.
You patient, So, sorry, Hessler. You, I don't care. Hero, dumbass. You can call me whatever you want. Because really, I was the idiot.
Not late for dinner.
Not late for dinner.
Yeah.
So just wanted to point that out, that this has anything to do with the VA. Anything we're talking about has nothing to do with the VA. This is just about our journey and how we came to be. So just a little bit, you're asking about my journey before I was in oncology. So I've been a nurse practitioner since 2006, and I was a registered nurse in Heme BMT for 10 years prior to that. So when I became a nurse practitioner from 2006 to 2015, I was in a bone marrow transplant unit in a private world. Came over to the VA in 2015 into the hematology department, and worked with multiple oncologists and hematologists there. And that's kind of my journey into the VA. Does that give you, is that what you're kind of looking for? Yeah. Okay. So
because you weren't very, I mean, when you and I met, you had only been there for a little bit of time, and I say a little bit of time. I mean, it wasn't
like 2 months.
Yeah, it was
before
like
I met you.
You,
Yes.
you came in, and all of a sudden you had my goofy ass come in and go, Doc, I don't know what I'm doing, but my body hurts. So,
yes, exactly.
So I, in a short span of, well, from 2015 to 2018, right? I want to kind of give an education, not me, but I want to educate people what chronic myeloid leukemia is, and explain the significance of what happened to me was. And Dr. Hiley had even said it himself. He says, well, I'm going to jump back. So when I didn't go to my aunt, first of all, everybody, if you're listening to this, I'm going to tell you, here was what not to do. Don't do what this guy did and wait on your annual doctor's visit. Okay.
Right.
And that's actually, and here's why. In December of 2012, I came in and I did a blood draw, normal, for Dr. Ali. And I was supposed to come back in July or April, right? For my actual annual, because of the physical, how all that stuff goes in the beginning of it. And so anyway, my blood was clean, and I was very tired, Doc. And I'm going to say this happened, and I want you to explain to the listeners what was really going on with my blood at the time, right?
Okay.
So I was very tired. I could go to sleep for 10, 15 hours, wake up 15 minutes, and be knocked out again. And I was working a night shift. I had no idea what was going on. And I missed my appointment in April because I was working, and I didn't think to go. And then I was getting more tired. And I finally made an appointment and went in July. And the week prior, we always do a blood draw 7 days prior to, or that was my doctor at the time. He says, go ahead, take blood draw, and then come see me. And they didn't call me. They didn't report the indicator where oncology had said, red flag, something's not right. And I went in July 29th or 28th or whatever it was. And Dr. Ali had said, we're going to stop right here. Do you know why you have 90,000 red blood or white blood cells in your bloodstream? I said, I don't know what you're talking about. He says, are you tired? I said, I'm tired all the time. But I just thought, because I was busy racing and working and all this other stuff. He says, I need you to go over to the VA clinic, and I need you to do a blood draw right now, and you need to come back. And they put a stat on it, and they actually did a molecular at the lab and verified CML. Can you explain what actually was happening to me with the white blood cells, and can you explain all that real quick so we can preface tonight with where we're going to go with where we're at today?
Okay. So maybe for the listeners, that a white blood cell count normally is between 6,000 and 11,000. So when you got that call from Dr. Ali, your white blood cell count was 90,000. So if we think about that in the grand scheme of things, that's a lot of white blood cells that you shouldn't have. So, and just to preface also, the diagnosis of chronic myelogenous leukemia, which is what you ended up being diagnosed with, the average age of a person being diagnosed with that is 67 years of age. So you were 35 at the time of your diagnosis. And to what you had mentioned earlier about that other person that was also diagnosed with CML that transformed to acute, there are 3 types of chronic myelogenous leukemia. You have the chronic phase, which is kind of where we want you to be. Accelerated phase is not good. Blast phase is bad. So actually accelerated and blast phase are both bad. So basically what happens is that in a chronic myelogenous leukemia cell, you have the presence of a type of chromosome called a Philadelphia chromosome, and that it is basically it is a myeloproliferative cell. So basically, a cell that, for lack of a better word, gets turned on and doesn't turn off. So that's what happens. You had this overgrowth of white blood cells that got abnormally turned on and didn't want to turn off. And so this translocation, or this Philadelphia chromosome, is what the cytogenetic test is. That's what you're talking
Mm.
about.
Okay.
It's called a BCR ABL,
Mhm.
and that's how we diagnosed you with CML. And then we also did a bone marrow biopsy in
Which
2013.
the first one you weren't there for that first bone marrow biopsy.
I
You
wasn't
weren't
there for
there
the
for.
2. I wasn't there for
Right.
the first one or the
Oh, the
relapse
second one. That's right.
or
You were
the
neither were. And let
imatinib
me,
failure. Yeah.
and ladies and gentlemen, I'm going to tell you that is the worst pain. I having because you're not sedate. And at the time, they didn't have the drill where they drilled through the bone. They actually used a T handle,
Mhm.
right? Like if
Yeah.
you're wrenching on a set of heads and you're adjusting rockers, you use a T handle, to adjust. They put a T handle on into this rod about yay long. It's just a needle, and they drill. And it took her about an hour and 10 minutes the first time to drill through. How thick is a bone?
Oh, I don't know, but it's
But
thick, and you're young, and you've got really hard bones, and it would
yes, because
just,
I
it's
like
not
milk.
any fun. Yeah.
It's not. And what happens is that they numb the injection site, but they do not. They When you start digging into bone,
Yeah.
you have to be awake because they have to know when they're through the bone into the bone marrow.
It's actually not probably we can numb all the bone and get into the bone. It's when we actually draw the marrow. That's your
Yes,
problem, because there's no numbing those little receptors in there.
Right.
it's like someone took a blowtorch to my
Yes.
legs, right?
Yes.
Both times. So, and then she happened to get the needle stuck in my bone and bent it before she could get it out. The lady actually had to stand with her foot on my hip and pull out, which it sucked.
Sorry.
Second time was kind of cool because she actually hit the same hole, apparently, and it didn't go as hard, but still worst pain in the world. But
Yes.
I will tell everybody, don't do what I did and wait 2 or 3 months before, if you're having these symptoms. So let's talk about, you and I got together, right? And you came aboard, and we explained the rejection of Sprycel. Like when I was rejecting
Imatinib.
the imatinib. Yeah.
Yes.
Explain that, because I think that is very key to how cells can reject like things like that. But
So imatinib was at the time you were so just a little bit background about CML. Prior to, I believe, these first generation tyrosine kinase inhibitors is what they're called. That is imatinib, which you were placed on. Prior to, I believe it was 2010 or it was 2001. I can't remember which. But prior to that, was the treatment for CML was autologous stem cell transplant. So before this was, so it was a lot heavier treatment than what this was. So um the advent of these tyrosine kinase inhibitors was like amazing, because it really revolutionized the way we treated chronic myelogenous leukemia. So you were placed on a first generation TKI, which that's tyrosine kinase inhibitor for short, imatinib. And you actually went into, you had a complete cytogenic response as of May of 2015. So you actually started, no, sorry, in 2014. In May of 2014, you had a full response. Unfortunately, by September of 2014, you had what they call imatinib failure. So your white blood cells were going up again, and they actually completed a biopsy again that did show your chronic myelogenous leukemia, in which they switched you to dasatinib, which is Sprycel, which is a second generation TKI.
Okay.
And yeah.
And that's normal. So, which on that is when the pain like got really bad.
Right. And that is a side effect of that drug, right?
I was just going to ask if that's what that was. Now, what is it? What is it that causes? Is it something that what is it that drug is doing that's causing the pain?
Well, it's treating the leukemia, but it's just a side effect of a medication. So, for example, if you're on I'm just trying to think of something simple. I want to say a statin therapy, kind of like atorvastatin or Lipitor, like, so you got that muscle weakness. It's not exactly like that, but it's kind of like a side effect of the medicine.
Gotcha. Okay. Yeah, because I'm actually on atorvastatin. Well, I was on atorvastatin.
Yeah. So that's actually just one of the side effects. Hypertension is another side effect. Pleural effusions is a side effect. Edema, weight gain, fluid retention. All of these are kind of side effects of the medicine, which was encountered by you in many senses of the word.
It was yeah.
Yeah.
It was. You couldn't, it was very hard, and you can attest to it, and I'm glad you were talking about all the other ones, because I did gain weight, and which inflamed, all that fluid pressure on the arthritis that I already had. It made it hard to work out. It made it hard to train. It made it even hard to drive the race car to be because of stamina and what have you not. But the fact that I remember you had how did I forgot I want to everybody to know how that conversation went, because I want it to be important for people to know that don't get scared, right? So let's talk about that rejection time, right? I my memory, and by the way, chemo brain is a thing, people. Okay, I do ever since being on chemo, I do forget some things. That's why I'm glad Doc is here tonight, also because I didn't know that I didn't tell her when I came CBD.
Which was
the right
you
time.
Trouble.
That's right. I'm going to get in trouble here in a little bit, but hey, but it happened. So, see, when you told me, I can't remember how you told me, but you told me that my counts were going back up, and it looked like that I was having a rejection. I had to go I remember doing another blood draw, but I don't remember anything specific on what you're saying or what you had told me about. We need to change your to the dasatinib and yeah.
Okay. So so that was actually, you were on dasatinib when I came. So you had just been
So that was Dr. Hiley.
That was still Dr. Hiley. So just if for listeners who have chronic myelogenous leukemia in the chronic phase, being concerned about imatinib failure is really not a concern anymore, because generally most oncologists, I'm not going to speak for everybody, would put you on the second generation TKI to start, which would be dasatinib, or there's other ones. There's something called nilotinib.
Yeah.
Yes, and ponatinib. So those are, but ponatinib, they kind of, or bosutinib, I guess, sorry. And then there's a couple of other ones. So, but that would generally be the way that they would start anyway. So if you have imatinib failure now, there's tons of options, especially if you're on imatinib now. So there's lots of things in the toolbox when we get to accelerated phase, which we won't talk about. I don't think we need to talk about accelerated or blast phase, because that's a whole different conversation than we're having.
Yeah.
So
yeah, and the pain, so the pain is where it was getting bad, and we fought through it, and you had me on the I mean, I was still on all my meds, right? The gabapentin and the tramadol and the things that to try to keep the pain and the swelling down. And this is where I kind of want to bring in everybody that is in a situation when it talks about all these meds, because in 2018 I came to you. I remember this after I gave blood every month. No, I gave blood every 2 weeks, and then I gave blood once a month, and then after a while we slowed down to
So,
like
yeah.
right.
So from 2016 to 2018, before you even tried CBD, we were trying multiple strategies to get you out
Yes.
of pain. So including meloxicam and duloxetine, which are very common and good drugs that have good effects for many people. But you did not do well with any of those. Plus probably your vitamin M therapy that you probably had multiple times in the army, which is Motrin.
Yeah.
Yeah, you guys. So you're
It
good
did,
old
none
vitamin.
of it worked.
No.
None of it. And I will tell you, and I want to say this also, even when you're on chemo,
Mhm.
I was beginning to feel better, and then it all just kind of like hits you, like the
Mhm.
effects of chemo start hitting you, and I was super tired. 2 o'clock, I was crashed out. Like it really is some gnarly stuff, right? So
Mhm.
we're gonna fast forward here to 2018,
Okay.
and I came to your office, and
Mhm.
I'm not going to go into detail of what I said, but I do remember saying, or I will say this, Doc, if we don't figure something out, I'm going to go this route.
Mhm.
And that very next day, right,
Mhm.
Mark had contacted me and said, "Hey, got something for you. I want you to try this." Now he had no idea that I had seen you, and this was the
Mhm.
next day. And I started taking it then,
Mhm.
and I called you and said, "Doc, I need to come see you. I want to talk about this."
Mhm.
And it was Zalise.
Mhm.
And in your mind, what went? And I don't think you've ever told me, but what went on into your mind when I said I want to try this, but I hadn't thought about
Mhm.
coming off chemo. What about taking me off all the other crap if I'm feeling better on this in time? I had said, can I get off all the other crap? I mean, besides chemo, and just try this.
So at the time, right, everything was pretty fresh about, you know, CBD, what is CBD, what is, what's
Hmm.
legal, what's not, all of those
Right.
things. And you sent me on a big journey of learning. And I had a folder like this thick of any article I could find about the endocannabinoid system of CBD and male and female parts of the plant. And it was a huge journey for me. So, but I knew you were miserable. I mean, you were still on a whole bunch of other medications. We were trying all of these kind of antidepressant things for neuropathic pain, and that weren't effective. So I was like, well, is it legal?
Right.
And that was a thing, right? And that was something we actually had to be concerned about for you because of what you did for a living.
Hmm.
And so we started on that journey. Actually, you started coming in to, we started doing urine tests to see if you would pop positive and all those kind of things, which was really cool because you never did. And that was kind of neat. Is that too much information? I don't know.
No, because
Um,
I
Absolutely
tell
not.
people about
The
that.
more the
That's
merrier.
yeah. So,
I'm glad you said that, because there's a lot of people that have that stigma. Chuck and I talk about it every
right.
week, and we hear it all the time. We hear it at the
Right.
Legion. We hear it out where like people like, whoa,
Yeah,
wait a
even
minute,
police officers
you
that
know?
we've talked to, oh, we can't do that. We can't
Yeah,
do that.
Right.
and
I'll come up hot on a whiz quiz, and I'm like,
Right.
probably
yeah,
not.
no,
So,
And I remember, well, before we go that far,
Mhm.
you and I had that conversation sitting in the office, and I said, let's figure this out.
Mhm.
I was still on chemo because I think I had mentioned it to you. Did I mention it to you, or did I have it in my head that it's probably not something that I should think about what if this, what if this works? Let's just fix the pain. So
Right. That's where
I
we were
was
at
working
in
on the
that
pain.
June. Yes,
Right.
that's where we were at in
And
June
yeah, I don't,
2016 or
was it
20.
June 16th?
No, sorry, May 2018. Sorry, I've got it written down. May
Somewhere,
28. Yeah. You weren't
somewhere in there.
sleeping well either. Things,
Mm-mm.
it wasn't
Yeah.
good. You weren't in a good space.
No, it was kind of a tumultuous time,
Mhm.
especially, in the home life, but
Mhm.
it all kind of subsided when I just didn't care, and then I only worried about my
Mhm.
health because one day you had said, and this is important about stress, and as we're sitting here talking about
Mhm.
dealing with pain and dealing with stress and chemo, because chemo can it exasperated everything, right? And so I remember I had done a blood draw, and you had called me and said, I don't know what you're doing, but you need to stop because
Mhm.
my BCR was up above 10, and you had told me, I don't know what's going on, but your blood is now back up and you need to calm it down. And what it was is things that was going on at home that I was
Mhm.
stressed about, right? So I had to come to a realization that my health was, she wasn't going to kill me because she's got issues, right? So I had
Mhm.
to reel myself in.
Mhm.
Um, but the for everybody listening, the goal behind getting on Zalise was what it was presented to me, and I'm glad it was. And thank you, Mark. Mark is also watching tonight.
Mhm.
Um, the goal was to fight the pain
Mhm.
from the chemo,
Mhm.
exasperating. So I don't want anybody. It didn't start off by me saying, "Hey, I'm going to take CBD because it's gonna wipe this thing out." We had no idea that
And
this was
and
going to turn into this.
and you were having non-detectable levels. So like you were in a good response.
Mhm.
It because you were taking your medicine. One of the other issues with taking things like this, as you know, and I believe that it was mentioned to you that this is a forever medicine. Like this is you need to be on this forever. And so these side effects kind of get crummy. And then you're on this for years and years and years. And sometimes treatment adherence is a real issue because people hate not feeling good, right?
Dr.
And
Hiley told me that. I
mhm,
want to say that you told me when we first started talking because you had to put out your, hey, I'm Dr. Bill,
mhm,
la 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 la.
mhm,
But Dr. Hiley, and I asked him, I remember asking him, I said, hey, Doc, how long do I got to be on this shit?
mhm,
And he said,
forever.
no one's ever come off of it once you get on it. Now, he said that to me. Now, I want
Mhm,
everybody that's listening to um, hear what I just said. I'll say it again. The chief of bone marrow transplant told me you will never come off of chemo with this type of leukemia. Won't happen because there's not enough research, number one, to show proof that the body does a molecular response on its own and stays off it, right? Because it genetically wasn't at the time, there was nothing there that said that could happen. So he said, once you get on it, you have to stay on it. If you take yourself off it, you're running a gauntlet, right? So I want to put that out real quick. So we're fighting this pain, and I had asked you constantly, Doc. I mean, what do we know about CBD and pain? Because you you went off on your own world on it, and you were
mhm,
like, "Hey, I found this shit out." And next time
mhm,
I remember coming in a couple of times. You found something new out. You
mhm,
found something new out. Tell me, what was your motivation? Not and take the light off of me
mhm.
for Dr. Jill. What was the motivation to learn more about this as we decided to go?
Well, you were kind of the motivation. That was the thing. I mean, so like if we could find a treatment that worked without the psychoactive part of, marijuana, and using full spectrum hemp oil, like that's a pretty cool thing, right? Because we know
Mhm.
the endocannabinoid system. If we innervate it and it heals people, and we can get decreased inflammation, we can have decreased pain. Hey, I can get treatment adherence with Drew. He's going to take his meds better. He's going to take them more often. I'm going to get more compliance. So, why wouldn't I want to know about something that could do it? And if it's not counteracting the medication, I mean, that's also a wonderful thing. And if it's not illegal, why can't we just use, hemp seeds and hemp oil and all that kind of stuff? I mean, it's all legal. I mean,
Mhm.
Exactly. Exactly.
clothing, for crying
Right.
out loud. So you were really the motivation behind it. And if we could work, if this would work for somebody like you, why couldn't we think about doing this on an expanded scale? Or, unfortunately can't recommend those things,
Right.
but that would probably be, I guess, does that answer your question? Sorry.
No, it does, because you and I there were so many times where we had talked about what exactly, um how does this work? Like, I asked you many a times, like, how does it work for pain? Because I didn't know, right? I mean,
Right.
Mark introduced it to me. I took it, and all of a sudden, in 2 hours, I was chatty Cathy, because it was like someone just hit me with a battery. Because when you're drawn down on chemo, so it pulls you down so hard.
Mm-hmm.
It's like taking a shot of 5 hour,
Right.
right?
I
And
haven't done that, but
yeah, right. And normally, like, that's not. We tell people that when you take CBD or Zalease, non-THC CBD,
Mhm.
you don't. There is no euphoria there.
Right.
There's absolutely not.
However, there is not. However,
energy.
when your energy is pulled so far down from chemo, anything that ignites you, and I'm 245, 250 pounds.
Mhm.
And it just was like, because for some reason, it just, it was a counteractive to all that down pain, right? All that down energy, right? So here we are.
Mhm.
And, we're going about this. And I said, Doc, I want to, I work in a job where, until the Farm Bill was passed by President Trump at the time, it was a no-go. Like, it was a no-go, right? And I said, I want to prove to people that you do not come up hot. Like, no THC. This stuff, and I'm going to say Zalease. I understand what it says on the bottle. This is Andrew Hessler saying this out of my own testimony.
Mhm.
I wanted to prove that it does not come up on your analysis. And I remember asking you, Doc, can you put me in for a drug screen? And I took a double dose of Zalease before I went and got my blood drawn. I remember I took 2 full droppers. I said, I'm going to suck it down. Bang. And when everything came back, I asked you how the results went. I think you either messaged me or I called you, one of the two, and you said nothing
Yeah.
came up.
Every time we tested you, nothing came up while I was in hematology.
And I think that's key, because you can hear from people that and I'm going to say this with all respect to Zalease and corporate board and everybody that's made Zalease what it is. It is by far life-changing. You're talking to the guy that it has, to include Chuck. It's changed his life. There was some time where you actually were on it a little bit for stress and stuff, right? So you have your own testimony, but I want to say that your analysis is out. You can look at my record, and I have proof that it does not come up on a urinalysis, right? So I think that was very important when we were talking about veterans, and we were talking about other people that might think, but you got to pee, you got to pee, you got to pee. And when we went down that little bit of testing and what have you, now, what did you think about how this could actually move forward or help other veterans that have that stand backish thought about it, and how would we talk to people that have that to say, I mean, I can't HIPAA violate and show you his records, but I'm here to tell you, you know what I mean? What do you say to that, Doc?
Well, I guess it wasn't so much that you had negative blood tests, but it seemed, I guess, in that sense, it made it feel safer to try it.
Right.
So in that sense, and I loved the idea that the psychoactive part wasn't a part of this, because
Right.
on the other side, a lot of the studies, when we look at THC itself and stuff like that, there's a lot of scary data about the THC side of things.
Right.
So being able to use full spectrum hemp oil without the THC, without the psychoactive component of it, was very intriguing to me, because if we could get people under control with pain, I was kind of in. So
And
that was the thing.
that was the thing that you first said, because we had talked about it, and you had asked me about my pain levels.
Right. Well,
I
no,
said,
and you even have, like, I mean, I have here from okay, so May 2018 is when you started. You weren't sleeping good at that time.
Mhm.
August of 2018, you felt like you were sleeping better. Your joint pain was improved in November of 2018. And I can't remember what the catalyst for me was, but you hadn't been in a race car for a long time. And
Yeah.
that was something you came to me on a visit and you said, got in a race car last weekend. I'm
Yeah.
like, what?
Well,
And like,
and
that was a big change for you.
it
So,
was, besides some of the mechanical issues we were dealing with, it was
Mhm.
getting in and out of the car that
Mhm.
got, once on chemo,
Yeah.
getting in and out of the car was absolutely, like, I'm a big guy as it is, but when you put in, trying to get your joints, and especially my shoulders, after all the
Mhm.
years of lifting and everything. But yeah, and then I started racing the next season, and yeah, I like can get in and out of the car. Like, it doesn't
Mhm.
hurt to drive. And another thing, and Mark just said it was all virgin ground.
Mhm.
That's the thing. Like, we knew nothing about what this was going to do to me.
Right.
And I remember that because I was teaching jujitsu,
Mhm.
and I told you, I said, Doc, I can jump and fly through the air again,
Mhm.
because I could stretch out. I could get my body to move and what have you not. So that was key for me.
Yeah.
And I had asked you at some point, can you please stop? I want to get off the gabapentin. I want to get off
Mhm.
the tramadol. And can you look in my records and tell me, like, when did I actually stop taking all that extra meds? Do you know?
It was pretty close to June. Well, I don't have the exact date, but so we actually flipped you from gabapentin to duloxetine.
That's right. Duloxetine. Yeah.
Yeah, and you were a mess on that.
Oh, it was terrible.
Yeah. And then so I
Oh,
think
that stuff's terrible.
at that point, I think you were pretty much off all of those things. So August of 2018 was kind of when you kind of flipped the switch and got off all that kind of stuff.
Right.
And then
So
so we never tried anything after that. I was like, "You're happy, you're not in pain, life is good, you're in a race car. I'm happy
yeah,
that you're doing what
my
matters
mood.
to you, right?"
Right. And the
So,
mood. Let me let's talk about the mood. And
mhm,
Chuck and I talk about this all the time, because, and again, we were dealing with this, a veteran, this past weekend, about his
mhm,
mind and things he's going
mhm,
through, what have you not, right? And we haven't talked about Vibe. This is just regular ultracell, right? I
mhm,
was on the ultracell limit. So January of 2019.
mhm.
So this is she's gonna call me out. I know it. So I have been telling
Don't be
everybody
fun.
wrong because of chemo brain.
Okay.
I had forgotten that I had. Okay, so I'm. I don't know how to go about doing this without sounding like a liar, right? Because this is terrible. But anyway, um, January of 2019. Um, I didn't tell Mark. I didn't tell my family. I didn't tell anybody. I forgot to take my chemo. Um, one day before I went to work,
Mhm,
and I got busy
mhm,
working on cars, doing all this stuff, and guess what? I forgot
mm,
again. And I
mhm,
realized, by counting my pills, I hadn't taken it for a couple of days,
mhm,
and I felt so much better.
mhm,
Like, I was awake. I could sleep. My the things were just feeling a little bit better.
mhm,
And I stopped taking my chemo. And that is that is when I didn't tell anybody. I thought I told you, but you have corrected me. So that was in January of 2019. When did you find out that I actually had taken myself off chemo?
June of 2019, because
Yeah.
you came and saw me in February and said you were doing good and your arthralgias were dissipating. So you, despite being off all the medicine, you were still having some arthralgias, but they were
Mhm.
much better. And
Right.
then in February, you were saying, yeah, I feel a lot better. And then it was June of June of 2019 that you were that you told me that you had stopped taking the dasatinib. So
Yes.
which was cool, just to kind of go from the CML perspective, from the medical perspective. You pretty much had an undetectable level for your response from May of 2015 to August of 2018. So you had 3 years of nothing. So nothing really detected.
Right.
And that continued through March of 2020. So just to let you know. So from a CML standpoint, that's actually a good thing. And there's been new studies that have come out that can support with certain criteria to come off this particular medicine.
Right.
Oh, and we can talk about that later. But yes.
So
In June of 2019, you said, "Hey, guess what?"
and it wasn't and I want everybody to know I kind of did this. I was nervous, right?
Mhm.
I was really nervous because Dr. Hiley and yourself,
Mhm.
we were very he was very in it. As every time I asked him to say how much longer do anytime I talked to him before you and I and how long do I got beyond? He says you're on up for life, guy. It's you
Yes,
have to
that's the
stay on this
standard.
stuff, right?
That's
That's
the
the
standard of
standard.
care. Mhm.
So I messaged you on the phone. I actually texted you say, "Hey doc," and this I remember because your response was epic, and I hope you can remember it. I said, "Hey doc,
I wonder if I can find it.
I did something," and your response to me was, "You took yourself off chemo." Like you instantly knew what I did, and I sat silent for a minute, going, "Damn, did I just?" Because mind you, I just went against everything that I was ever told, right, from Dr.
Right.
Hiley, from my Dr. Ali. You know,
Mhm.
you're gonna be on it for life, you know. And if it weren't for Dr. Ali, I would have never known that I had this. So I thank him in the very beginning. But what did you think? Like, I never have asked you this because after that, you and I came in and I saw you and we talked about it, and you gave me that look like,
Mhm.
you know, are you sure? You asked me, are you sure you want to do this? But when I told you that, I really have never asked you what you went through your head when I did that.
Well, um, I'm sure I was.
Not
It's
happy.
hard to look back now, but I mean, yeah, I was freaked out.
Doubtful, I'm sure.
And I said, "Okay, we got to tell Dr. Holly about this."
Yes, yes, you did. Yes, you did. You
um,
said we need to talk
and
about this.
and like, and I, this was where this is where you have a good relationship with your provider or your, and this is where it becomes a team decision and an informed decision, and
Yes.
talking about things, like, because I'm, and I think you and I have always had a very transparent relationship, because I'm like, I'm not, like, this CML could mutate, go into accelerated phase, or this could be really bad.
Hmm.
And and we had that conversation, and you're like, yeah, I'm still not doing it. And so at that point, then it comes comes to, like,
Already.
what are we going to do to keep you safe,
Yeah.
and how are we going to take care of you? Because this is your choice, right? You know the risks, you knew everything that was going to, that could happen. Okay, so, like, let's put the next plan into action. How are we going to take care of you and honor what you know? And those are all principles of being a good provider, because we're bound by, do no harm,
Yeah.
principles of beneficence and all those kind of things that we look at in research and stuff like that. And so I was like, okay, well, if you're going to do this, then you're coming back to see me every month for the first year, which was
Yes.
actually a little bit overkill now that I look at the new data. But back then, I think everybody would have been okay with that. And we were going to just keep a really close eye on you. And
It was a tumultuous time.
it
I,
was.
I I had all of the confidence in the world. Let's talk about that for a second, because you and I had many a conversation. And Chuck and I talk about this, and as we learn more and more from the Zalise board, medical board doctors, Dr. Emily, Dr. Todd,
Mhm.
and everybody that actually have their own specialties that are also part of this. You know, the research and information is more prevalent now than what it was then, right? So
Mhm.
but you actually didn't stop. And Chuck and I talk about research,
Mhm.
and Chuck is the same way. Like, he researches, he'll read some and he'll tell me, like, dude, I read about this. Did you know about this? I go, no, I don't know about that. Did you read about
Mhm.
that? I had no idea. So it's a true statement, because I forget even what I did 5 minutes ago, and he's like, I just told you this. I'm like, no, man, I can't remember. But when
That's
when
what
we
that's
were sitting,
for. Man.
yeah, when I was sitting in your office and we were talking about this, you looked at me and said, Dr. Hiley needs to know.
Yep.
And I actually got nervous, because I was afraid that going against policy now, and this is hospital, this is policy there, that if you decide to go against medical care, things can change in a heartbeat. Like, they can go like, okay, well, then I'm done with you. And if you're not going to follow my guidance, they can say, then go to your doc in a box over here and try to get some help, right?
Mhm.
It rocks.
Yeah.
You and him had a conversation about this.
Mhm.
What did he tell you?
Well, we actually looked at the data. We looked at some of the data, and he was like, "Well, if he's gonna do it, then like, let's just keep him safe and let's figure out a plan of care on how." And again, it's a team approach, right? This is your body. This is what matters to you. You feeling better. You're getting to do the things that you want. You know the risks. You
Mhm.
knew them. I was very honest with you. Um, and so he was, in the end, he was okay with it. I don't think it wouldn't have been his choice. For you to come off the medication, but it wasn't my choice either, right?
Right.
So we had to do it together, because you're not going to take the pill. I mean, so we have to honor that. And
It,
that's where it comes into being a team and advocating for what we need to do. And you weren't silly about it. You weren't um I kind of said, if you start popping positive, you're
yeah.
back on this.
Right.
And you're like, okay. So I mean, and so it was, we set up parameters for what was the right thing to do.
Right.
And for you, we
Right.
set up parameters because you weren't going to go rogue, and you were willing to, um, you know, do everything that we needed to do to keep you safe, because you didn't want a bad outcome either. So,
No, I remember that conversation too, because you sat down with me and said, look, I can't. This has to be very, very watched. Like, you and
mhm.
I need to communicate very well about it. So we went through that phase,
Mhm.
right?
You
And
went for a whole year.
I
You went
went
to
for a
March
whole
20,
year. Yep.
2020, and you had no detection
And
after
now
being off it. Mhm.
I want to tell everybody out there, I'm going to say this, right?
Mhm.
I was taking one dropper of Zalise a day. I was off of chemo and all my pills. And through this time, you have the blood draws. Now let's talk about my counts going back up a little bit, right? Because after we found out the science, and now that we've learned a lot more about how CBD works on cells and proteins and everything. Um, uh, my count started going back up, and you had found out, and this was before I had learned from the corporate side of Zalise about like how it really works, because it just we didn't know, but you actually stumbled upon the cannabinoid that actually attaches to the same protein as chemo does, or something of that where the cells could not bind and mutate, right? So that's you had found that out, and we had talked about it because my numbers started going back up, if I recall correctly. I mean, you can tell me I'm wrong, but that kind of happened, right? Where we had talked about that.
We did, but I don't remember exactly how that all transpired. It was a long.
It was long.
It was a long time ago. So, but what you always have maintained a major molecular response. Up until March of 2020, we couldn't even see that you had anything. So
Right.
after March of 2020, things came up a tiny bit, but you always have maintained a major molecular response to therapy. So, or to, to being off the dasatinib.
Right. So that's indicative, because you had told me there had been a couple other veterans with the same CML that said or tried to get off of chemo, and within a short period of time they had to get back on it.
Yeah, so there's an interesting study. There's about 10 or 12 studies documenting people who, like, at 12 months or 24 months being off the medicine. There's an interesting trial stop to GTR1. That's probably the closest to where you're at right now. It's a small amount of people, but the dasatinib was a second line treatment, and that at 4 years, you're kind of in that 54% of people were in a response.
Right.
So this isn't like, everybody can do this. Yeah.
Right. And I think, and I'm glad you said that too, because you had told me over this whole point of time that this is it's very awesome for research. And this is where you kind of said, okay, now we're gonna go a little bit further, and we're gonna ride on this, and we're gonna actually do some research on why this does what it does. CBD in general, full spectrum CBD, right? Why does it do what it does to everything, and particularly cancer over here, right? So how is it that Dr. Emily, and I'll say this, and Dr. Emily, she wants to talk to you at some point, and she was on one of the podcasts, and we actually talked about what the attaching of proteins, right? The CBG part, the cannabinoid CBG attaching to proteins and what have you not. And it acts like chemo because what it does is it doesn't allow other cells to attach that protein so they can mutate, right? So we had stumbled upon this before we knew anything about it when we went through this. And when she came down for an event we did in May, back in May, she came down and we met for the first time. And she says, so tell me about, tell me how this all went about. And I said, well, I told her this story, and I said, Dr. Jill and I don't understand why or how. And she said, oh yeah, it's what happens is it attaches to the protein, right? To that receptor, and it keeps other cells from attaching and mutating. So I'm producing cells. My body is one that's going to continue to produce cells, but we're preventing it from attaching in the same form that chemo would, right? So with that,
Possibly.
yeah, that's the way it's looking right now, right? With all the research that's out there. I mean, again, it could turn on me tomorrow, and we never know. But when we talk about the time that I got off of it, because I was going through a divorce, there was things that was going on, and I couldn't afford being on Zalise. I didn't get back on chemo. I didn't get back on any of my pills.
Nope.
So let's segue into that real quick, about that. I hadn't been on it for over a year almost, and I was still doing blood draws and what have you not. Let's talk about that real quick, so that maybe we can give the listeners kind of an understanding too that there is, when we talk about the body changing and learning to kind of like fix itself or heal itself, or the endocannabinoid system kind of getting regulated so your body can, function properly. I'm not a doctor. I don't know if what that's mean. I was off of this, producing cancer cells that were not mutating, off of this for a year. And you said you found that intriguing. Talk to me.
So it looks like, and so you, again, you maintained a major molecular response. So despite being off ultrasound, despite being off any of these things, you were still maintaining a response.
Right.
So no reason to go, to start you on dasatinib again. I just and you've only been on this new one for a few months.
May, I think.
Yeah. So, and it just is kind
Yeah.
of intriguing because, and I don't know, is it correlational? So there's a lot of things that have changed in your life also over the past year. I don't think you have as much inflammation or stress as you did during that period of time, for the last couple of years. So that could be something, but yeah, you look like you might be in a deeper molecular response. Your numbers are even more, or even are now looking like they were back in August of 2020 when you kind of you were still on it. But
That's intriguing.
Mhm. So I don't know what that means. I like numbers.
So as you look at this, and I'm gonna say, I'm gonna talk to Chuck for a minute about this too, because he um you had asked me, right, about getting off all of your meds, if as we were going on your Zalees journey, right, Chuck? So did you remember that conversation you and I had about, we had talked about, I don't want to be on all this shit anymore. I don't want to be on all these pills anymore. No, I mean, seriously, I mean, you know what I mean? And you actually weren't seen for a while. And then we introduced you to ultrasound.
Well, I'll be honest, man. Since I've been on ultrasound, um, well, I've been on ultrasound, and then now for 2 months now, it's been ultrasound vibe. Um, every time I check my, and I'm not saying that Zalees is the cure all end all, but I will say this: stress levels are down drastically. Same things going on around me, except I'm just not freaking out like I used to. Okay. So I got a better mindset. My blood pressure is better. Only thing that I'm really fighting hardcore now is just cholesterol. That's it.
Yeah.
So I mean, all the other pills that I had, and of course, they had me on pills for pain for my legs, my back, my neck, my elbows, my wrists, just about any joint that I have, due to arthritis or whatever. And I don't even barely take those anymore.
So I'm glad you said that, Chuck, because this is where I wanted to ask, as Dr. Jill. So we did a blood draw. I did a blood draw about 3 weeks ago. Was it 3 weeks ago? So yeah.
Yep.
Because I actually wanted you on the podcast, last week, but or actually sooner than that. And you said, well, wait a minute, because I talked to you about the vibe, right? The ultra vibe and the CBC and what have you, not right, and how it works on the brain and whatever. And I said, I only been on it for a few months, and it was your idea to say, well, I'll tell you what, let's do this, right? Let's make it intriguing.
Yeah.
Let me do a blood draw on, since you being on Vibe, and see how your numbers have changed, if any, and what the response was. You had said something that when I was off of it, even off of ultra, I was taking nothing, by the way. I want to make sure listeners understand. I was off of chemo, I was off my pills, and I was off of CBD. I was taking nothing, walking around with cancer in my body. And Doc, you said that my numbers were actually looking even better at that time, right? Is that it, or is it now? You're saying now I'm looking.
So you have been beautiful since 2015. You really have. So, but you were absolutely negative. We could not detect anything in your blood in March of 2020. So but from March of 2020 to now, you had very low levels. I think you stopped the ultrasound sometime. I think you said January or February of
It was
21.
January
Right.
2020,
Right.
21. Yeah, because
21. So they were about, so your response is about what it is now. After being off it bleeped a little bit, not to indicate that it was coming back,
Mhm.
and not to indicate anything that we would add medicine to you. You were still in a major molecular response. It just, your numbers look like they did back in August of 2020 when they were just like a touch positive.
Okay.
Way cool.
And
Okay, go ahead.
can you
Sorry,
see
go
it? Yeah, and for Chuck, because Chuck, you asked this question. So Doc has being on the Vibe now, right? With the other cannabinoid in it, the CBC. Do you see a difference in my blood from, or is it pretty much the same? There's nothing really standing out, because CBC really is as Dr. Todd had told me,
Right.
it's really more the receptors in the brain to deal with anxiety and mood and what have you, not, which obviously helps with blood pressure and things like that when you're not
Right.
whacked off in your gray matter. But
Right.
so let's talk about this in a big picture, right? If Dr. Joe were to have to do this again, if you and I were to have to go through this again or do this again, or if anybody asks you what would we do differently, what would that be?
I don't know, because we did everything we could to keep you safe. You maintained, I mean, for you maintained a major molecular response, that you didn't have to go back on the medicine. Your body hasn't done anything bad. I think for quality of life, for you, being able to do the things that you want to do, I think the ultracell is kind of a thing for you. It decreases pain, it keeps you active, it keeps you doing the things you want to do. Like, I mean, you were on nightmare medications, you were on a whole bunch of other stuff before, and now you're not on any of it.
Exactly.
I'm glad you said that,
But
because
you need
that's
more vitamin D. Just saying.
I
But we
got
could
it.
Does
talk
the
about
body
that.
good?
Okay, so yes, I have the bottles in there, and I got 6 bottles sitting in there, and
Good.
gotta do better at taking that. Yeah, so people,
Yes.
take your vitamin D. You heard it here, right? Nitros said it. Take your vitamin D. So 50 meters and the write up, the case study, based on all of this, and veterans out there and anybody that's watching that has just been in my medical life, that just given me, um and Dr. Emily's watching too, and she just texts me, says, vitamin D, do it. I said, I know. She's a veterinarian too, so imagine that. She's probably telling all the cows, I say, y'all drink milk all the time. I can't even get one of my ambassadors to take his vitamin D. It's terrible. What's wrong with this guy?
Now I got somebody to
So
keep you accountable anyway.
I know, right? I got bananas over here. So what it, we get it a lot. Chuck and I get it a lot. I am not a spotlight guy, but I did put myself kind of at the Hell's Gate when I did this. And I don't know that I would do anything different. What were you, let's talk about the case study when we want to put this out in a way where people can say, one, besides doing your research, don't be afraid of the stigma behind CBD.
Please
Don't think that you can take all your meds. I took all these meds that had side effects and CBD to counter that, and there was no issue. Like Chuck and I tell people all the time, there are no side effects to this stuff, right? And the headaches, the nightmares, the sleeping, and everything that sometimes meds don't. Yeah, Mark just said, I remember my PTSD and thrashing night moves going. I was violent when I slept.
Mhm.
And so if you were to be able to wrap this in a ball or in a package and say, here's the deal. This is my honest opinion. This is what we have done. This is what we have we did this to the human body, right? And we've seen through blood draw. You've got all my medical records there. People can, people can. I want them to see that you're reading from the data. This is not anything that is we're making up. This is strictly from what is inside this idiot's body. How would you, or how are we going to go forward in making sure people understand that this is a legit thing? Like, if it can help me, it can help you. The case study, right? We're going to do a case study, which if you could explain that. I know I've had questions about that from some of the Zalise members. They thought that was pretty remarkable. I'm not a doctor. I'm just thinking it's another paper, but
So I think what we would do is we would document your journey just from a medical standpoint and talk about, what are the guidelines, because we do have data now, the most recent NCCN guidelines, and this is where I've taken all the data and that there's studies in that there is data for you to be able to come off your dasatinib. I think what is probably more or what I find more interesting is that CBD really is a tool that we can use in our toolbox to help decrease anxiety, help, decrease pain. Um, you can have a better quality of life doing those things. And you know, I'm impressed with Ultracell in the sense that, it's a very clean product. It's a full spectrum hemp oil. So a lot of things that happen with in the supplement world is just like medicines, right?
Mhm.
We pull out and we use one thing. And we know that using things like full spectrum hemp oil with all of its components, minus the psychoactive part of it, you're getting a lot more benefit.
Right.
Um, you've proven that, and that's the beauty of using supplements versus using some pills for some things. And I think that's the big takeaway here, um, is that, I mean, you got back in a race car. That was my profound moment in our journey for me, because
Yeah.
I know that you said, I haven't been able to get in a race car for 2 years. I haven't been, I've had this rage and anger and I hurt and blah blah blah. And then you're like, you're racing.
Yeah.
And so that was the thing for me that went, "Oh," and that is the cool thing,
Yeah.
like being able to take care of you and seeing that you're able to grow and get away from all the crap that you
Yeah.
dealt with. So
Yeah. Does Ultracell get rid of? Never mind. We'll move on from that. Chuck, I know that you had some questions, or
Well, the one
you know,
question that I
for
did
Doc.
have,
yeah.
now there for a while, we as we said that uh, Drew had stopped taking it for a short time,
Mhm.
and when he got back to it, during that specific time, that levels weren't like super high or super low, or they're
Mhm.
pretty much kind of stable where they were.
Mhm.
Now, just out of curiosity, what makes that possible? Was it just the fact that maybe his body had stored that much of the cannabinoid at the time, or was it just because his body's just saying, all right, we're going to kick this thing's ass and we're not going to mess around and take names? You know what I mean? We're just going to
Right.
knock it out now.
So, and I don't think we know the answer to that. I would say, because we do have, like, there's 10 or 12 studies out there that there is criteria, in all of the studies. Essentially, there's about 40 to 50% of people that,
Mm.
stop this medicine or stop one of the other ones that do have some kind of response, but that's only 50%. So is it his body saying, hey, yeah, I'm done, I'm good? Maybe. Does it have something to do with both, that he had enough in there? I don't know the answer to that. He was pretty stressed out, so it was
Yeah,
it's
well, Yeah, I mean, and the thing of it is, because I've been there, and
Yeah.
well, not with leukemia, obviously,
Yeah.
but with my own physical issues, bad heart, blood pressure, cholesterol, intestines are bad, headaches constantly, all that stuff,
Mhm.
But and I will say, um, before I started taking Zalise,
Mhm.
okay, and I'm not afraid to say it or ashamed to say it. I used to smoke weed, you
Mhm.
know, but it was, not where I go out and just get so hammered or nothing like that, or inebriated. To hit two, that was it,
Mhm.
and just, just to kind of get enough to, okay, now I can deal with my leg hurting because I mean I had a total knee replacement after I can't even remember how many leg surgeries putting my leg back together because I almost lost it in a motorcycle accident. So, and yes, I am going to ride again. So, but that was my big thing. CBD for me has just been amazing. I'm glad that Drew showed me this because my quality of life, my stress, my sleep, my health is better. Um, I mean, even like I said, I even bartend at the American Legion down the road, and from when I first started taking it to now, I mean, even my our patrons at the cantina even say, "Dang, Chuck, you must be feeling a whole lot better because you sure do get around a lot better." And I
Right.
do, and I have to say thank you to Mark and Drew for introducing me to this. And now that I've used it and it's working well for me, um, I believe in it so much that I'm an ambassador now.
Mhm.
I believe in it wholeheartedly, 110%. So, um, I have to say thank you to him, obviously, while he's my best friend. So, I
Just
mean,
don't do what I did. Right? Just hey,
well,
do that. Hey, I will tell you, consult your physician before making any drastic choices because I did not.
I haven't.
I
I
did
still
not.
haven't.
Well,
That's
then
just
don't
what we
start
do,
now because
Ms.
then
That's just
quitters
what we
never
do.
win, right?
Right. Right.
And it's very important that Chuck, that that everything you've been through with your body. See, this is the great thing, and I can't wait for you, Dr. Joe. I can't wait for you to talk to Dr. Emily and Shannon and Chrissy and
Right.
everybody. We're going to get a meeting and where we'll all talk because they're just so intrigued by what you and I did. And I say you and I
Mhm.
because you could have said no. You could have said, I don't want any part of anything that can happen. Dr. Hiley could have said, I don't want any part of it,
Mhm.
but you didn't. Um, and for that, you've kept it in the back of your mind to always take take all of what we've done and still be able to tell veterans there is a better way, right? Because if as you look at my medical records, um, and I'm sure in the back of your head sometimes when you look at other veterans that are kind of going through the same thing or whatever, this has to sit behind in the back of your mind going, God, just you and I've talked about it. You and I've talked about how can we get, and hence why Mark and I started charity, because now I
Mhm.
can give this shit out for free and I don't need anybody's permission.
Mhm.
But this is where having people and people that care like you do. First, you I gave you my life in your hands because I did not want to hurt anymore. I did not want to go through the pain that I was going through. And that's not the greasy wheel getting there. That's not the squeaky wheel getting the grease. That's true because I was so active. And I want to say this with all due respect to all of our veterans out there. You still have to take care of your body by diet and exercise. I mean, I'm going to tell you, I lived in a gym, I dojoed, I worked on race cars, even though that's more of fun than it really is working
Mental
out, but it is
mental ther
tiring. So it is a
mental
workout.
therapy.
Trust me. Yeah.
It's mental therapy.
It's mental therapy. Correct.
Mhm.
So the fact that you did this, I have to thank you for not looking at me and saying, all the negative things that a lot of doctors could say or probably have said to certain to
Exactly.
veterans. You hear it all the time. Let's talk about this real quick. You hear it all the time. Chuck heard about it until he got told to go over to 151 or to Audie Murphy. Because I even told him, go see Dr. Jill. You need to just go see Dr. Jill. Did I not, Chuck? And
Roger.
you know, and then of course he had to get released from his doctor to go do whatever it is, whatever. But
I don't even know what my new doctor's name is.
you are in my opinion and veterans standing on the outside, to include everybody at Zalise that are doctors that have seen, that build this product, they formulate it, they research it, they like Dr. Todd is a sleep specialist, right? I learned more in 15 minutes from that man.
Man,
It was absolutely, and you need to go on the podcast and watch it with Dr. Todd, because he's a sleep specialist, and we actually talked about sleep, talked about the brain and how it sleeps at night, and what have you not, right? So it takes people like you, though, to take everything that we have done and that you've decided to care about and pass it to another veteran. I can hand this stuff. We as a charity can hand this stuff out to every veteran that we talk to, every veteran that has a problem, everything. And we're not doctors. So for you and the medical board that actually takes the time to research this, you didn't formulate anything, but we put it to the test. Like you were there next to me putting this stuff to the test. So we are validating what the doctors that put this stuff together, you know, in a sense, like we were their case study, if that makes sense, right? So for that, it takes special people like you to see through it. I'm glad you saw through it with me. You could have said no. You didn't even have to talk to other veterans about it, and you did. You have talked to other veterans about this. You know that when you could, or however the red tape is, you know, that goes with that. But it is a life changer. But it also takes people like you to believe in that, yes, this can help. This can do certain. Don't be an idiot and do what Drew did. But if you want to go down that path, talk to your physician first. Now that we have all this research out there, and hopefully this case study, when we do it, and people that watch this can actually see, there's nothing here that you need to be afraid of when it comes to all the research that's been done. We have medical proof, physical proof of what it does. It's not a theory anymore, right? There's nothing guessing on this.
That's a real deal, man.
How would you present all of that if someone were to come up to you right now and say, okay, I listened to you, I listened to the podcast, I'm tired of hurting, this is what's going on with me, how reluctant or how motivated would you be to go, well, here, this is what we did, and I think it can help you?
So it's difficult to have some of that conversation in my current position.
Sure.
But without the THC, that conversation is a much easier conversation. I'm very interested in what CBD looks like. Could we do it on a larger scale? I'd like to see what that looks like. I mean,
would hope so.
there's been there's many veterans that have come and said to me that, you know, I'm doing this and I'm doing that, and I actually always go away from the THC part of it because that part I'm not in agreement with. And you have had really good results without the THC.
Absolutely.
And when we start adding in the psychoactive stuff, and you add in PTSD, and you add in a whole bunch of other things, this just sets us up for not good things.
Right.
So yes, I do have the conversation. Yes, I'm definitely not opposed to CBD without the THC. I like the idea of full spectrum hemp oil. Like I said, when you're using all the components of the hemp seeds and hemp oil, I think that's a really good thing. I mean, the more we can use something as pure as we can get it without causing side effects to
Right.
people, I'm in.
I
I'm in.
agree.
It's a
100%.
great anti-inflammatory. I mean, it really does
Mhm.
work for a lot of stuff. Um, so yeah, I mean, and Ultracell is a great product. Like I said, it's very clean. And that's one of the things I like about it as a
I
supplement.
can't
So
say it.
yeah.
There it is.
Um,
Yeah, it's
so
stuff.
yeah.
All their products, right? All their products are.
And to what you're
Yeah.
saying is, Drew, it's a real um being able to do what I do. It's an honor and a privilege to be able to take care of you guys. It really is. It's been a journey. But it's amazing that I get to take care of you. So it's an honor and a privilege that you want me to take care of you. So that's pretty cool too. So
It's,
so
it's
there's some that's wrong with
questionable on my actions, but
that.
yeah, you know,
Yeah, but again, the
yeah.
fact that you can be honest with me and that you can, because any veteran who sees me, they know that, I call a spade a spade. I will tell you if you're full of it. I will tell you, we need to change plans. I will go on a journey with you and, maybe right, wrong, or indifferent. Um, but we'll do it together. And at least that way you're not alone out there going, oh yeah, well, I'm going to do this. And I fail miserably. We have you know, we had a lifeline and we just did it together. So,
I think that's important. What you just said too is I want veterans out there that happen to watch us later on or what have you not is there are people, and I'm gonna say the VA because we talk about
mhm.
VA issues and on some of our podcasts, on how to help people navigate the system to get care and to see, to do whatever. But it is about the person, right? It is about the person wanting to go through this with them because it can be daunting too. It can emotionally daunting. Look, I um to, to, to to sit here and say that it has been an absolute pleasure to have someone like you care about all of us, not just me, but all of us, and to be that one guy out of the thousands of veterans that you deal with to go, I ain't doing it. This is what I'm doing, and now your head scratching, going, what's wrong with you? Um, it is an absolute, uh, it's a huge guiding light to be able to go and take our charity out to the veterans. Also, Relief for Troops, Gearheads and Guardians, going out and handing this product out. I didn't tell you this, but the lead, Dr. Emily's, I think she's listening still. But the Patriot Board and Shannon, those people gave us they donated 2 cases of Ultra Vibe to hand out to veterans. We have 2 cases, or we have 4 cases now to hand out at a pop-up event we're going to do.
Way cool.
And what
That-
we did here tonight, what you've done, Doc, right, has a bigger impact than what you may think
Facts.
that you may have ever thought but in your care. Everything that you did through this journey has never been done before. And we can take that and go, we have everything you need, vet, to show you that this will help you get better. These products can help you on a better way of life. We're not going to tell you it cures everything.
Mhm.
What we can tell you is that it's going to help give you a better way of life. And
That's fact.
we have everything. Yes, Chuck and I say it all the time. The facts are in the paperwork. And I can't tell you what it means to have you on tonight. We talk all the time.
Mhm.
I'm gonna see you here probably in the next couple weeks for
I think so.
another blood
Yeah.
draw, whatever. But for all of us vets out here that I do get to talk to and give my story is because of you. My story to be able to do this is because of what you and Dr. Haley had done for me,
Mm.
and I can pass it on to Chuck. I can pass it on to everybody that's listening. You were key and instrumental, and still are, on this journey as we continue to go on and see what happens. I'm stuck with it with life, so I guess this is like a lifelong thing. So you're kind of stuck.
Sorry, but
Happily
you're stuck
so.
with us. You're stuck with it.
So
Happily so.
we're getting to be about we're getting it's an hour and a half. I kind of
Yeah.
knew it was going to go this far, but let me just say, for all of the veterans out here that you've taken care of and what have you not, we love you.
Mhm.
Thank you for what you've done. For me personally, you kept me alive.
Mhm.
I tell people that all the time. I don't think people will understand the gravity of that. Right? Cancer is not a joke. My dad had 5 cancers, and he was taking Zalease. I introduced him to Zalease after his second cancer, and all of the cancers had shrunk in size. And his doctor said, "Whatever you're doing, you keep doing it." And he was on Zalease. The gastro took him from us. That was the fluid. But this stuff works. This stuff does things that nobody could ever thought it could do, except for the people that actually do the research, like yourself. So thank you for all you've done. For everybody that is watching, this doc is absolutely amazing. She cares about you. Go see her. If you need a referral, I have her office number, and we will set up a line so that you can go talk to her, because she cares. Oh, and acupuncture, if you need some of that, hey, we can get some needles driven into you. Chuck, is anything else you wanted to say?
Well, actually, yeah, I think you said just about everything I wanted to say, but I'll be truthfully honest with you. But
Say it
there's
in
one thing
Italian.
that you didn't say that I have to say. Doc, I just met you like what, hour and 40 minutes ago, roughly.
Mhm. Yeah.
It's I don't want to get emotional.
Oh.
It's been a privilege and an honor. I just want to say, from the bottom of my heart, thanks for taking care of my best friend. He means the world to me, and just thank you.
Oh. Well, thank you, and thank you guys so much for having me. You guys really are amazing. Like I said, it really is an honor and a privilege, and I'm humbled every day that I get to work with all of you. So,
And I swore I'm not a sissy. I swear.
you aren't. It takes a grown man to do that. I'm telling you. And
But,
thank you.
No,
'Cause,
I really I can't say thank you enough. He's been for the latter part of my life, he's been a big guiding light for me, and it just means a lot that you were that you gave a damn enough to do that for him. So
well,
thanks
you.
for giving him the chance and
Yes.
and accepting the whole ultracell journey,
Yeah.
because now we you've seen it. You're a doctor or a nurse practitioner, however you want to label it, but you've seen it firsthand. You know that it's real. Dr. Todd, he's a sleep specialist that works with Zalease. And Dr. Emily, she works with Zalease. She's a doctor, and she it's an amazing product. And it's not just the vibe, but everything they make is just it's advances your health so well.
Great.
And
yeah.
But the truth of the matter is, now that I've kind of got my Adam's apple back where it's supposed to be, just thank you so much for everything that you've done to help my buddy and other veterans that are out there too. And I don't know if you're still over at 151, but I know I got an appointment over there coming up. Maybe I'll see you and I'll get a chance to say hi.
Well, yes. Oh, well, if not, come to Audie and come and say hi to me there. So,
right on, right on.
Yeah.
Right
So
on.
no, I don't frequent 151 too often. But if you come to Audie, that's where I hang out. But who knows? You never know.
Right on, right
It
on.
changes. So
Yeah,
Well,
and
cool.
I think I can speak for the years that Mark and I have been trying to get the charity moving.
Mm-hmm.
All the people that we've finally been able to touch, we hand out bottles and get this stuff in their hands. This journey has been very, very important for me, and I'll thank you again for making sure that I didn't put myself in a gauntlet,
Yeah.
because it could have happened at any time. So, Doc,
And I will continue to make sure you don't put yourself in
yeah, I'll take my vitamin D. Jeez, for the love of God. Because, by the way, I got that message the other day. She texted me and said, "Your vitamin D is in the garbage. Take it." So, apparently, I'm
Apparently.
not doing too hot there, Doc.
Yes.
Um,
Yes.
we're getting close to our time.
Yeah.
I want to thank you again.
Yes.
Anybody out there that's got any questions, Gearheads and Guardians at gmail.com, info@reliefortroops.com, or at gunner6 at gunnerswag.com. Reach out to us if anybody has any questions for Dr. Jill. I'm sure that you'll be back on in the future. I don't
We
know
hope.
what other crazy shit I can do to my body where you have to intervene and go, well, here we go again, right? Unless I'm in traction from rolling a race car or something like that. But
No, we can document your journey on how you got your vitamin D level greater than 50.
so what I did was I got this text message and I happened to have to walk into the bathroom and open up this little pill that says take 2 a day.
Yeah.
Right?
Vitamin
And it's
D,
got her name
homie.
all over it. Right?
That's right.
Vitamin D. I don't know. I didn't say I was very smart. I took myself off of a life-saving medicine to trust science. Okay.
Right. Mm-hmm.
I don't know if that's brilliant or not, but it did something.
You're here
so
today and you're amazing.
Thank you for joining us, Doc. And
thank you again for having me.
Of course.
Always a pleasure.
We love you. I love you. And I'll be back in a couple weeks for another blood draw. Be ready. How do you do that?
There you go.
Yeah, there you go.
Why does mine look like I'm drunk or something? Oh, anyway.
You probably need to.
Probably.
Yeah, don't worry. My daughter helps me with that too. So.
It's. Oh, by the way, is this good for you? I don't know, but I'm drinking it right now. So
zero sugar.
Say something about that. Go ahead.
Okay,
Yes,
I could say something. You don't want to hear what I have to say.
See, here we go.
You really don't.
For all of you,
not milk.
You really don't. For everybody else out there, remember, Chuck, we say it all the time. 988.
Pick that phone up. Call 988.
It's very important.
About hurting yourself, pick up that phone for the love
Pick
of
the
God.
phone up.
Please pick up that phone. Get in front of your laptop. Gearheads and Guardians at gmail.com. And if you have a phone and you have the VA app, you can get on the VA app.
Yes.
And use that VA app as well. You can get somebody to chat with you right there on the spot.
Yes.
All right. Don't take this lightly. It's very important. We need you to be in the fight.
Mm-hmm.
Otherwise, we all lose.
Exactly.
That's right. And if you didn't hear from Doc, I'll say it again. We need you. All of us have to support each other. Right. Teamwork makes the dream work. Yeah. And we got some thank yous to you, Doc. Mark says thank you. Mike, MC Aquatics, he says thank you. He's listening in. Dr. Emily said she will be there at the meeting when I organize this. We wish you the best. I'll see you next week, probably for a blood draw. Right. And I'm going to bring you 2 bottles of Ultra Vibe on Relief for Troops. I want to get it in your hands, and so that you can become part of the Vibe family. We're going to get a good vibe going. Right. Oh, by the way, talk about vibes. Quick plug-in.
Yes.
April 14th, Dallas, Texas. AT&T Center. ACDC's only stop in Texas will be there. And I'm going. Bro, to do it.
Way cool.
Oh, yeah. So, by the way. Oh, wait. And there's more.
Last but not least, definitely not least, the Hero Company. If you're looking for a really cool Christmas gift to give to your veteran husband, boyfriends, anything like that, these bracelets. Now they got different styles, but this is just one of them. This is actually the Knights Templar one. All right, this is the Knights Templar. They also have really cool Cuban chains. that's tangled up in my concealed carry permit.
Yeah, the Heal Company is very awesome. Yeah, they're a veterans charity that all the money they raise goes to
veterans charity.
Yeah, they're a veterans charity that raises money to help service animals for veterans.
Oh,
To get
Yes.
service animal like service
Way
animals
cool.
for veterans.
Yes, they're very very
Really
awesome.
Super cool. Super
And the
cool.
jury is 100%. Like that is some stuff. So
It's no joke. It's no joke. And I mean this stuff, I mean I got this and I showed my girl and she's like, and you walk around with that thing on your neck all day? I'm like, yeah, why? She goes, that thing is heavy.
like a bulldog.
But yeah, if you guys really want, if you're on a really good charity to help a veteran, that's another great one. And I know on my Facebook, on the Gunner's Choice Facebook, I've posted a couple links on there, like it's an affiliate thing, but I'll post it on the Gearheads and Guardians as well, so that way we can get that out for y'all. Absolutely
Awesome. Well, thank you again, Doc.
All right. Thank
This
you
was
for having me.
amazing.
It was
Very
amazing.
informational. And Chuck, let's go ahead and send this one off, man.
I forgot what I was going to say. Oh, that's old timers, not Alzheimer's. That's old timers. Because what's today's date? The 22nd? Or no, today's the 3rd, right?
Yeah,
24
days off,
more
guys.
days, man. 24 more days. I'm going to be 55. So I'm old timer. Anyway, shoot straight, go fast, and be safe, guys. We love you. Take care. God bless you.
Be safe. And always remember, Nitro said it.
Right here.
Thank you.